as well. Hi everyone, good afternoon. My name is Navneet Sandhu and I'm a program manager with Health Begins. Welcome to our first session of the year for our San Joaquin Stanislaus Collaborative Planning and Implementation. Excited to have you all here today as we kick off the first session of the year. So just a few quick reminders that this meeting is being recorded. And if you could, please update your Zoom name with your name and the name of your organization. That just makes it easier for all of us to know who's in the room. And then for our icebreaker today, I thought it would be fun to ask everyone what their what one place on your travel bucket list is. So for me, I think it's definitely London, and hopefully I can do that sometime this year, but would love to know what you all are thinking about for traveling. And then as always, we hope to make this an engaging and informative session, so encourage you all to listen in, engage, whether it's through unmuting or using the chat function and connecting with one another. I'm seeing in the chat we have Italy or Greece, Vancouver. It's very beautiful there. Switzerland, that is definitely on my list, but I think I need to save some more money before I make it there. Disneyland, Italy, Greece. This is definitely inspiring me to travel more. But definitely feel free to continue to drop those in the chat. It's fun to read through. Okay, so for anyone that's new or joining this meeting for the first time, I do want to extend a warm welcome to you. Thank you for joining today. We're thrilled to have you here with us. Our CPI monthly meetings are a space for regional Medi-Cal transformation stakeholders, so known as CalAIM, to collaborate and identify challenges, problem solve with the goal of improving CalAIM implementation and driving utilization. So welcome aboard. Definitely please ask questions as they come up. But I will pause if there are folks that are joining for the first time and they would like to share a quick intro. I know we always appreciate the opportunity to meet the new folks that are joining. So we'll pause if anyone wants to do a quick introduction.
I'll go ahead. My name's Crystal. I'm with Pair Team, so this is my first time attending, and I'm happy to be here.
Awesome. Nice to meet you, Crystal.
I'll go ahead and introduce myself. I'm Maribel McCarroll. I'm the BHSA Policy Manager for BHR Stanislaus County. Nice to meet everyone.
Great. Nice to meet you as well.
I'd like to introduce as well. My name is Amanda Ashow. I am Head of Community Supports with Zocalo Health, and we are currently in discussions with the managed care plans here to come on board as an ECM and community supports and CHW provider. Thank you.
Nice to meet you, Amanda.
I'll go. Hello, everyone. Hi again. I'm Kathleen, home instead, Stockton.
Awesome. Nice to see you again, Kathleen.
Hello.
Anyone else?
Hi, this is RX Healthcare. Good to see you again, Navneet and team. Joe, Lenore, Michael. Hello, everyone.
Hi there. I will also introduce myself. This is Sandeep Bhatia with Home Instead Stockton. Nice to meet everyone. This is our first time. Thank you.
To meet you as well, Sandeep. It's always great to have all the new folks join us. Okay, so we'll move on to the next slide. So just a quick preview of today's agenda for our meeting today. As always, starting off with our welcome and level setting. So we'll also go through our session objectives, and then we will spend a good chunk of our time today going through quite a few general updates. So we have some important policy updates coming down the pipeline from DHCS. We'll also share some more information on cited round 4 and a few new resources that have become available since the last time we talked. We'll also hold space for regional spotlights. So this is everyone's opportunity to kind of take a second to spotlight any of the work that you all are doing that you think would be important to highlight with the collaborative. And then we will also have MCP updates, so we'll hear from each of our plan partners. And then we will kind of end out the session with gaining alignment. So we'll talk about defining our shared goal for the year. Also share some exciting updates on our upcoming in-person session that's going to happen next month in Modesto, and start planning for the agenda, and then wrap up with some reminders about our upcoming office hours and one-on-ones. For our session objectives today, by the end of the session, participants will receive important updates from DHCS regarding policy pertaining to funding opportunities and transitional rent. We'll also receive important updates from our MCPs pertaining to presumptive authorization, as well as the new ECM standard referral form. And we'll define our collaborative goal intended to guide our work over the next year, and then we'll kind of close out with some planning for our upcoming in-person session. So with that, I'll pass it over to Gretchen.
Great, thank you, Navneet. Hello, everybody. Gretchen Schroeder. I'm really inspired by all of your travel ideas. I've got to start planning my travel for 2025, it looks like. So we're going to cover the DHCS policy updates, including PATH cited, and some of the other things that are going on that are kind of adjacent to CalAIM. So we can jump into the next slide, please. So just want to make sure everybody was aware that at the end of December, the federal government did approve California's BH Connect waiver, which is very exciting. It's going to add about $1.9 billion to the Behavioral Health Workforce Initiative. And as well, it also included transitional rent approvals. So as of right now, we're still waiting for additional guidance from the state, but as of right now, transitional rent will be optional for managed care plans to launch July of this year, but mandatory for managed care plans to launch in January of 2026. What we do know about transitional rent is that we'll offer up to 6 months worth of rental assistance, and it's going to be tied to behavioral health. So we can start to have this continuum of support for folks from transitional rent community supports to the behavioral health housing resources. And exciting, the transitional rent will become the 15th community support that will be offered in California. And of course, we have more information here. And as we learn more from the state and get more guidance, we will share it with all of you in upcoming sessions. All right, next slide, please. There's another program that's launching, which I was really excited to learn more about. This is the maternal, it's called Transform Maternal Health Model, and it's going to be a 10-year pilot looking at how we can apply a whole person care approach to maternal health care and systems. And this will be launching in 5 Central Valley counties: Fresno, Kern, Kings, Madera, and Tulare. So we're looking forward to learning more about how that goes. And so if you guys are involved in that, we hope you'll share some of the updates with us as this program launches and we start to see some changes. Next slide, please. And then I know we've talked about this before, but we'll keep talking about it because it's really exciting and really big. The Justice Involved Reentry Initiative in California does allow folks to enroll in Medi-Cal and to receive a set, our targeted set of services up to 90 days pre-release. Very exciting. It's being launched county by county, and counties can choose when they go live. And so right now, the go live dates that we're aware of, San Joaquin County will have their sheriff's office go live at the end of this month. We do know the California Department of Corrections and Rehabilitation will be going live February of 2025. And then we have heard that Stanislaus County will be going in fall of 2026. So what all of this means is that ECM will be available to folks upon release, which is already happening now, but then we have folks in the reentry model who will qualify for some of the same care coordination services that will then transition into ECM. A few counties in the state have already launched these services, and so we're going to be sharing some of their lessons learned and best practices as we hear from them with you all. So just keep that in mind. Next slide, please. All right, and then we did just get this flyer, which is really exciting. Another CPI facilitator group, HC2 Strategies, is going to be launching a webinar series for hospitals and health system leaders. I'm trying to help them see where the alignment can be between hospital activities and CalAIM services, and so some practical tips, some successes. And so we encourage you all to let your hospital partners know about this free resource, the flyers and the slide deck, and to invite folks to attend. I think there's a real big awareness of what an important role hospitals can play in CalAIM and getting folks into services. So we hope that some of these webinars can help hospitals start to figure out where they can plug in. And kind of, I think sometimes the hardest part is what is the first step? So hopefully this series will help with that. All right, cited round 4. So anybody attend the transitional rent cited round 4 webinar this morning? Do I have anybody with hands up? Okay, Carrie, so you probably can help me. So we heard during the webinar this morning that they may be extending the deadline for PATH cited to May, though we have not seen any official guidance. So we're going to watch for this, and as soon as we find out, we'll let you know.
They said several times May.
I know, but I
It
want
was
to
weird. I was like, I thought it was March, but okay.
I know. I think with the transitional rent pieces, they see that folks need more time to really do this well. So yes, we heard May 2nd will be the new deadline for PATH cited round 4 applications, but until I see it in writing, I'm going to just keep going with the March 7th deadline for right now. But Carrie, if you hear more, please let us know.
Yeah, I mean, all they said was that it would be notified on the website shortly or released.
I keep checking. I keep refreshing that website.
Okay.
I haven't seen it yet. I'm a little impatient though. It was just this morning. Anyways, in addition to that big change, there was also a lot of information that has been shared over the past month or so around PATH cited. The state has done, I think, a very good job of putting up resources that are going to be helpful as you think about an application, what you want to get funding for. And so we have a lot of these pieces linked here. So I hope you will all take a look at that. One of the big things it was on, and I'm going to forget, it was the how to strengthen your application round 1 webinar. They had some really good examples of how to write your narrative to incorporate maybe funding you've gotten before, either from PATH cited or other resources, and how you're not going to duplicate funding. They had some really good examples of how to focus on creating a strong narrative and budget. And we do have, next slide, please. We do have some more webinars coming up that I think will be really, really helpful. There's one next week, February 3rd, how to make your application stronger, part 2. And this is going to really focus on the budget piece of the application and how to write your milestones. So I really encourage everyone, if you're considering PATH cited, to check out the webinar on February 3rd. The previous webinars the state has held on round 4 are all on the website, with the exception of the transitional rent from this morning, but hopefully that will come on soon. And then in addition to these webinars and the slide decks that are up, they also are having office hours twice a week until the application is due. So I really encourage folks, if you're thinking about PATH cited, if you're in the application and trying to figure out some pieces of it, go to the office hours, ask questions, talk to your peers here in the CPI today. We have some folks who have done PATH cited before, and they can certainly help you kind of start to plan out what you'd like to do. Let's go to the next slide real quick. A couple things the state has really put forth that I want to emphasize with all of us today is, let's pretend the application is due March 7th still. We're going to go with that written down deadline, even though we know it may change. We really want to have folks start to think about how they can be ready to access and use these dollars. And so the state has shared some internal steps they want applicants to take to be ready to go. One is to really discuss your plans with your leadership, with your board. If you do have to hire, or you do want to hire new staff and you need approval to do that, make sure you have that before submitting the application. So just keep that in mind. And then the big change for round 4 is that it's going to be a 1-year funding cycle, and they really want folks to be able to do these things within 12 months. So if you're trying to hire staff, for example, how many staff can you realistically hire in a 12-month cycle? The state is calling this 12 months thing be shovel ready. So have all of your information ready to go. So if you do get funded, you can start day one. You don't have to spend a lot of time doing the planning to utilize your cited funds. Externally, the state really wants to encourage everyone to make sure that your project aligns with the community's gaps and needs. In the guidance document for cited at the FAQ section at the end, they do have a list of what I consider to be kind of outdated resources for gaps and needs, but it is what the state is using for applications. I think it's also important that we talk about gaps and needs here today, and we can reference those conversations in your application. You know, during our PATH Collaborative, we talked about some gaps and needs that we're having in San Joaquin County. So you can start to write your application in that regard as well. If so, cited is for folks who are currently contracted for ECM or community supports, or folks who intend to contract. If you are not currently in contract with a managed care plan, either for a community support service that you want to use cited funds for, or to serve a population of focus, you're not currently contracted, or you're just brand new to this space, you will need to get an attestation letter from your managed care plan partner. And I know our plan partners would love to have those requests come in as soon as possible, so they don't want to hold up your application because of an attestation letter. So if you are thinking about PATH cited, do you need that attestation letter, please reach out to your managed care plans to request that sooner rather than later. And the other piece of advice the state has had is that if you are going to be purchasing an EHR, for example, or have other things you're going to be purchasing, have those vendor quotes already done before you submit your application. So again, you're shovel ready, you get the funding, you're ready to go right away. So that's really important. Any questions or things to add to this slide from our cited experts here? All right, well, let's go to the next slide then. So as we mentioned, we're trying to make sure that all of our applications for PATH cited really line up with what our gaps and needs are in our communities and our counties for ECM and community supports. So what I thought might be helpful is to have a conversation. We know what some of the managed care plans have submitted through their IPP plans about where their gaps and needs are. We've seen the data from the state, so we know maybe where we are not enrolling as many members as are eligible and how we can address that. But I thought we could have a conversation about what are you guys thinking about for PATH cited? What are some of the gaps and needs you think need to be addressed, and what can be addressed with the PATH cited 12-month funding cycle? Do we have enough providers in our two counties to really serve everyone who's eligible for these services?
Would you say providers? What if you can just elaborate, Gretchen?
So if we have, do we have enough ECM providers that are contracted with the managed care plan to serve the birth equity population of focus, for example? Or to do recuperative care?
Hey, Gretchen.
Oh, go ahead.
Hi, it's Eliana with HealthNet. I'll say that for HealthNet, we at least have a sufficient network of providers. If there are new providers who are interested in, becoming part of our HealthNet network, I definitely, send me an email. Let's have a discussion around that. But as of right now, the only gap that we currently have in San Joaquin County is for sobering centers, and we're working with a provider to close that gap.
Great, thank you, Eliana, for addressing that. And Crystal, please jump in. Carrie, I saw you came off mute as well, so please jump in here.
Oh yeah, I was just trying to get clarification. I know we're an ECM provider. I think we're like the largest one in California. And so I just wanted to just clarify on the question.
No, great, thank you.
Yeah, and I was just curious, and Eliana sort of answered this a little bit, but about what the what providers had identified as their gaps. And so Eliana answered that for HealthNet. I don't know if there's a different answer for Kaiser or health plan, but that was my question.
No, great. I don't know. Camille, I don't know if you want to come off mute and answer from the Kaiser
of course.
perspective.
I think from Kaiser's perspective, I do know that, to your point, Gretchen, birth equity and recuperative care are things that we're always sort of like looking for more providers. I think birth equity specifically right now, our team is thinking about statewide. That has been a gap that we're seeing across our 32 counties. And so ways to promote kind of birth equity providers universally is something that we're always looking for. But if you're interested in, and I'll talk a little bit about it during our MCP updates, feel free to reach out and connect with one of our NLEs. We're actively doing kind of a network adequacy kind of analysis to figure out like where are our gaps, but right now we're welcoming providers to kind of reach out if they're interested in serving KP members.
Wonderful. Thank you, Camille. Anyone from the Help Town of San Joaquin want to chime in here? They haven't joined quite yet. Okay, so it sounds like we have some ideas of how two of our health plans are thinking about provider networks and adequacy. Are there other gaps that folks are feeling? I mean, I've heard from other providers across the state that we need to really educate members and non-providers, so our community referral partners, to really come in to make referrals in for folks that could benefit from these services, to connect the dots for our members. I don't know if that's a need in our two counties here today.
I just had a quick question for Ileana. Is there a need for recuperative care and post-hospitalization for adolescents in Stanislaus and San Joaquin?
Great question. Now you're making me think. So we do not have a gap in those particular services. I think we're continuing to explore what our gaps are in order to serve the full population, right, including children and youth. I'm going to have to circle back with you on that just to ensure that the providers that we have, in fact, do serve children and youth, because I think you may be calling out a potential gap that we may have as it refers to that particular population. But let me circle back on that.
Thank you so much. I appreciate that.
Yeah, of course.
What other gaps are people thinking, or what are some promising practices that we should scale across the counties here? Maybe cited dollars could be used to help with those.
I mean, I can just speak from my personal experience that our biggest gap is with billing internally, making sure that we're, you know, billing to our fullest capacity, making and tracking all of that. And I know I at one time spoken with somebody from San Joaquin County Health. They were talking about maybe being like a centralized location for, you know, CBOs who are looking for some support from billing. I don't know if that's ever going to come to fruition or not, but that's our biggest need that I'm going to be applying for help with through PATH cited as billing specialist internally.
So are you thinking about hiring new staff to come in and support you, or hiring consultants okay, so new staff. Okay. And of course, cited always wants to know, great, we'll give you money for staff, but what's the sustainability plan here going forward? So that's always a key component of the cited applications. That's great, Carrie. Sure. Thank you for sharing that. John?
Yeah, I was just going to piggyback off of what Carrie's talking about, maybe in regards to hiring like a revenue manager, a revenue cycle manager, somebody that can assist you with the billing aspect, the claims aspect. I don't know what system you're using in regards to your EHR, but having a rev cycle manager is always a plus. So that could be potentially somebody that you could, you know, put on that PATH cited application for funding.
Great, thank you, John. All right, anyone else want to chime in? All right, and if nobody else has a burning desire to share, we'll keep going. We'll go to the next slide. We had a question come up in our PATH cited learning lab that we did in December that we didn't have the answer to. We have since reached out to PCG, who administers the cited grants. And one of the question was, if a provider is notified they've received a cited award, can they begin spending those funds to hire staff, for example, or do they need to wait until they have received the funds? And so the answer we got is that providers can begin spending the funds, but keep in mind that they will not be reimbursed for the funding until they complete their first progress report and it's reviewed by DHCS. And they have, of course, some more links in here to support that answer, but wanted to make sure we shared that out since we did have that question come up and we did not have that answer. All right, let's keep going. Now that I've
Gretchen, can I ask one question
please.
with that? So do you know the date in which we could essentially start spending? Do we know yet what that date would be, that it would be backdated to?
That's a great question. I do not know. I don't know if anybody else who's a cited expert knows. It may be in our report guidance.
Well, now that if they push back the application, that would change maybe as well.
Well, that's the thing too. Like if we've already been planning on this and we have this March 7th date, I don't know if they're going to change when the funds will be released. So initially we'd heard the first reporting period was going to be October, start in October. So I don't know if they're going to change that start date or if it's going to go further out. That's a great question, Carrie. Yeah.
Yeah, that would be helpful to know. But as far as you think that probably the first reporting is in October?
That's what the original guidance had given, that the reporting period would start October 1st, which makes me think that, you know, initial everything would go right then. My assumption, again, I'm not an expert and we need to read the guidance. My assumption would be that if you were applying for cited, you could start spending dollars. And then as soon as you achieve that first milestone with hiring the staff, for example, you could then bill the state for it. But we should look into that and make sure that's correct. John, I see you shaking your head. So that's how they've done it previously, but I want to make sure we read the guidance for round 4 specifically.
Okay. Yeah, that's how we did it previously. We would provide a breakdown of the people that we've hired, their salaries, the total cost, and then we would submit that to the state for a milestone completed, and then we would get a check after that.
And just to add on to that, because PCG did direct us back to their webinar for the timeline, and what Gretchen was saying around the reporting period, at least what they've said is it would start October 1st. So like by quarter basis, October 1st through December 31st. And then the report would be due in like mid-January, for example. But that's also tentative to what we knew the deadline was. So if they're going to extend it, it's also possible that they're going to push out when the awards can begin. But just wanted to share that as well. And we have the webinar slides linked in this deck as well, so folks can reference it at a later point as well.
I would just keep checking back on the cited website. So if they do announce that extension of the deadline, and they may have some other guidance that comes along with it. So that's what I'm going to be doing, not by the hour necessarily, but probably pretty close. We're all anxious to get this figured out. All right, so next slide. So I've been talking a lot about all the state updates, some really exciting program updates. I would love to hear from all of you about some of your updates. It can be about some of the spotlights or highlights or successes you'd like to share with the group. It could be about upcoming meetings or events that you're a part of. But yeah, please share. Anybody have a success they want to share broadly?
I'll share something exciting.
Great, Carrie. Love
So
it.
we got a grant from San Joaquin County for a laundry trailer. And we are starting our laundry program on February 4th. Here in Tracy, we'll be the only provider of free laundry in Tracy. So we're super excited. We've got 6 washers and 6 dryers being hosted for now 2 days a week. So we have our shower program Monday, Wednesday, Friday, and now we'll have our laundry program Tuesday, Thursday. So we're going to have services 5 days a week now. And just really excited to get that off the ground. So
that is great news, Carrie. Thank you for. And who's eligible? Yeah. Can anybody show up and get their laundry done?
Anybody is eligible. Yeah.
Wonderful. Yay. Great news.
We're really excited. And then there'll be others, you know, case management, food, clothing, all that other stuff provided while they sit for about an hour that it takes for their clothes to wash. So we have a captive audience and we can say, hey, how can we help you get housed or whatever they need? So yeah, I'm excited.
Wonderful. Okay, great. Love it. All right, anyone else?
That's amazing, Carrie. Congrats on that. That's awesome.
Hi, thanks, Kendra.
Hi, Kendra Kaiserman with Gospel Center Rescue Mission. I just wanted to give a quick spotlight. We just had a graduation last 2 weeks ago, 2 Sundays ago, and we had 16 New Life Program graduates of people who have changed their lives from homeless to now change their lives. So it's awesome.
Yay, congratulations. That's very exciting. Anybody else? Oh, I love all these successes. Okay, keep them coming. Put them in the chat. We'd love to hear them. Really fun to see all the progress that you all are making and the folks that are getting help. So, Catherine, did you want to say anything? I see you came off mute. Okay, I guess not. All right, well, we'll move into our health plan updates. Do we have anyone from the health plan of San Joaquin on yet? Maybe we'll come back to them. All right, let's jump into, is Kaiser up next? No, Health Nut, Eliana.
Hi. Hi, everyone. Good afternoon. So great to see so many new providers joining the call today. And I think, Naveed, you may have the power to move to the next slide over. Or actually, let me just definitely highlight a training that we have available tomorrow. This is going to be our Connecting the Dots. This is a series that HealthNet has created, and we really touch on different topics that we think that, or either questions are being raised, or we find that that may be a gap in information. So we, as Gretchen mentioned, we do have our San Joaquin Correctional Facility going live in 3 days. So we're really excited to lift these services that we know are needed in the community, especially for our members who are re-entering the community. And so we have our Connecting the Dots, Supporting the Justice Involved Population of Focus training. This is going to be happening tomorrow on the 28th from 2 to 3:30. There's a registration link attached to this, and it will also be recorded and most likely available within the next 2 to 3 weeks on our CalAIM resource page for providers under training. So you can definitely take advantage of those resources there. If we can go to the next page. I just wanted to highlight that the MCPs have a new requirement to ensure that we have alignment on our ECM referral forms, and we wanted to share that. Those have been updated on our CalAIM resource page for providers website. You will find an ECM referral form for adults and one for children. Those are also linked on this particular slide here. So if you have any questions, or you have it's challenging, or you're not able to open it, please feel free to reach out. We want to make sure that you have access to those forms and that we're routing those referrals to our ECM services. The next page. A few resources that we've also developed in the last few months. This is going to include our quick reference guide. This is going to detail the ECM population of focus as well as the eligibility criteria. We know that we have a handful of populations, and sometimes those eligibilities may get a little bit confusing. So we created this one pager that details the population as well as the eligibility criteria, hopefully for ease of the referral making or just knowledge base. The next page that I'm going to show you here is going to actually detail how you can make those referrals for ECM. There's 5 ways that you can make those referrals, but as you know, there's no wrong door to make these referrals or identify members who could benefit from these services. We have our portal access, we have Find Help, and everything's linked here. We also have our provider directory that's also linked by calling member services or by faxing the referral. So those are all the ways that you could make a referral, but you can, call an ECM provider directly. It sounds like, Carrie, you're going to have some captive audience there. We can have ECM providers there, and we can make those warm handoff connections to get links, members linked to services. So a lot of different opportunities for linking members to ECM services and community supports. If we can go to the next slide. I just wanted to continue to remind, again, the resources that we've created, and we really vetted these resources for our providers or those who are interested in becoming providers. We have our authorization guides, and these are one-pagers that really detail what is the service under community supports, what is the eligibility, what documents do we need. And I think what I really like about it, that is it details how long is the authorization for, right? When we're working with a member, we really need to know how much time do I have in order to get this done. So all those details are included in our authorization guides, which I find very helpful every time I'm talking to someone. I say, let me pull this up, let's review this together. And I'm also linking here our referral forms for each of our community support services. So you also have access to those in case you have any referrals that you would like to make. If we can go to the next slide. Lastly, I just wanted to link ongoing resources that I feel like everyone kind of knows about, but I love to talk about them. We have our CalAIM resource page for providers, which is a completely, I think it's so much information on there that you can get any question answered for our CalAIM providers. It has frequently asked questions. It has a lot of our forms. It has our trainings. One particular resource that I like from this page is our end-to-end process. So if you're a community support provider, you can go from the first time I interact with this member to billing for that service, and all those resources are completely available to you all. We also have the second link here is our CalAIM resource for members. These are our member facing documents, which you can print out. We can also mail some to you, to your organization if you need us to. And these are information that you can share with your members as they're interested in becoming an ECM enrollee. I wanted to highlight our community advisory committee. This is really an opportunity that HealthNet creates to ensure that we're hearing from the community and not only our members, but also our providers, what's working, what's not working, what's working really well, what improvements can we make? And we also take this opportunity to present new information to the community and kind of get that sense of, would this work if we implement this in this county or in that county or in this region? So we really want to hear from you all. What I really like about this opportunity is that if members attend, we host 4 a year, so one every quarter. One meeting a quarter. If members attend, they're eligible to receive a $100 gift card for every time they attend. So a great opportunity for our members to not only get their voice heard, but also to get an incentive for being there. The fourth resource here is our HealthNet transportation services. So I wanted to link the flyer that has been coming up lately of, does HealthNet provide transportation? And yes, we do for our members who are seeking to attend their appointments and a variety of different appointments that could be dental, behavioral health, your primary care appointment, picking up your medication. So that information is also linked here. And lastly is our language assistance resource. Lately, I've also been hearing, is there opportunity for members to receive their documents and maybe in a larger font? Maybe they have some visual impairments, and we do have those resources, and we want to make sure that members are receiving their documents in a way that they're able to read and that it fits their needs. And lastly is my contact information. So in case you have any additional questions, feel free to reach out.
Wonderful.
Any questions from all of that? Great. Well, thank you so much. And again, thank you to all of them.
Eliana,
Yes.
hi, I have a question for you. I was
Mhm.
trying to find like a referral form that we could give to additional providers so they can refer your HealthNet members to us. Do you guys have a form?
So the only form that we have available is the form from a entities that could be a provider, a clinic, to HealthNet. We don't have a form that could be shared between like your organization and another organization, if that answers your question.
Okay, that does. Thank you.
But I know that other providers, and I'll call out Turning Point, they've created their own form that they take as a referring form to their services.
Yes, that is correct. Thank you.
Any other questions for Eliana?
I'm just curious, Eliana, like what kind of utilization have you gotten from members showing up to get those gift cards? Because we've tried to help some of our clients do it and haven't gotten much luck.
Yeah, I think we continue to encourage. I don't think we've seen the number of members that we really want to see attend those calls. I've thought of different options, like, if we're, but for example, I'm gonna call out our name, like St. Mary's dining room, right? They may have an open area where like 10 members could come in and just kind of get on the Zoom call and they're there. So I think there's different ways that we can make this work. So if any organization is open to kind of trying something out like that, where you have, again, a captive audience, and we just schedule it on this date, that they're there, that could be an opportunity to increase attendance in those calls.
We would be open to that.
Okay, Carrie, I have a meeting with you later.
We do.
We'll chat about it.
Okay, thanks.
Great. Yes.
Hi, Eliana. I had a question regarding authorizations. So we had submitted some HealthNet authorizations in your guys' portal for the G9008 and G9012 HCPC codes for the ECM authorization, and they were actually pretty much we got a fax back just stating that we don't need to submit authorizations if these codes are used because these members are already pretty much eligible, so we don't even need to submit. We could just start services, right? So I just, Eliana, you're muted right now.
That's correct. Yes.
So I was trying to get some clarification so I could just share it with the team. I tried to ask our point of contact for HealthNet, but he hasn't gotten back to us. So that's why I want to just hop on here and just ask the question. But like from my understanding is that obviously if they're on the MIF, then we know that HealthNet sent those members. We already know they're eligible for the ECM services. But would we do the same thing for someone that like was referred from another organization that has HealthNet as their MCP, but then we do need to submit an authorization for that member as well, right? Because this referral came from an outside organization.
Yeah,
Or
great
what?
question. And so definitely let's follow up with your point of contact, but I do want to answer that question for the rest of the team. So we do have, again, our end-to-end process will show you, okay, if this member was on your MIF, then this is the process or the step you take. If this member is not on your MIF, then this is the process you would take. But it sounds like we need to work on some of those that are pending. So Ravina, if you don't mind just shooting me an email, include your point of contact, so we can kind of figure out like where are we getting the lack of communication. And you're right, HealthNet removed the prior authorization from ECM services in 2023. So we have not required that for a while now. And so we do have, I think, a pretty strong process around that. So let's just get you the right information.
Okay, thank you. I appreciate it.
Yeah. Great questions. All right. Well, thank you so much. And again, reach out to me with any additional questions.
Great. Thank you, Eliana. Always great information. All right, Camille, you're up.
Thanks so much. Can you go to the next slide? So a couple of updates here. I think I've shared this in the past, but I wanted to lift this back up because we only have a couple hundred spots left open. So this is a complex care certificate. It's a totally free training resource from Kaiser Permanente in partnership with the Camden Coalition. It is a 9 self-paced online kind of course. It's free 13 CEUs. That's really intended for frontline complex care staff and teaches them how to engage with complex health and social needs. Folks can leverage this to kind of get closer to that CHW certificate. You don't need to be contracted with Kaiser Permanente at all to leverage this free resource. After I'm chatting, I'll drop the link in the chat for folks, but you can see at the bottom there's a URL and kind of a registration code. When you're registering, feel free to put that code as your coupon and you will be able to access all of the training courses for free. You can start it whenever. We do have under 300 codes left that might have decreased. We've been promoting this like crazy for our January PATH CPIs. So really recommend folks to take advantage of it. We've heard some really great things and it truly is best in class. Okay, so that's that. We can go to the next slide. This is not specifically for Medi-Cal, but I wanted to promote this because the open enrollment for this program ends January 31st. So Kaiser Permanente is offering a community healthcare program for Californians who can't get coverage through any other means. These are oftentimes folks that can't necessarily get Medi-Cal or don't make enough money to kind of purchase coverage on the marketplace. So Kaiser Permanente is offering kind of this free program for folks that don't qualify for health coverage any other way and reside in a KP service area. The eligibility is listed on the left. Coverage is oftentimes $0 for out-of-pocket costs and includes a number of different kind of covered services. We find that a lot of folks that kind of apply for this program are oftentimes undocumented and fall into kind of that gap of services. Open enrollment ends in a couple of days. We've been promoting this as much as possible. So if you know anyone in your community that might benefit from this, feel free to kind of share this information out. I will also drop a link in the chat when I'm done talking. And then I have a couple more updates. If you go to the next slide. So this is just a reminder, KP has a no wrong door approach for referrals. So we'll accept referrals from literally any source, members, providers, family members, community organizations, etc. You can place that referral via email or phone, or if you're talking to your PCP at a Kaiser facility, they can refer you through the EHR Health Connect. So in Northern California, which is where we are, you can either call that number on the left, send the referral form, and indicate whether it's an ECM, community supports, or CHW services requested, or a combination of one of those three. And then as a reminder, if you are contracted with a network lead entity, so in this case, it'll be Full Circle Health Network or ILS, and you would like to see that member return back to your organization, you can send that referral form directly to the network lead entity instead of sending it to Kaiser Permanente, which is a little bit different if you're referring someone to community supports, but you don't actually serve community supports in your organization, you would still send that to Kaiser. But if you are contracted, if your organization is contracted with an NLE, you would send that referral form directly to the NLE. And then speaking of NLEs, if you go to the next slide, We are really excited to announce that there are additional opportunities for you to connect with your network lead entity in your area if you are already contracted and have questions for your NLE, or if you're interested in kind of learning more about what that contracting process looks like and you want to start serving kind of Kaiser Permanente members. You can join either one of the office hours for ILS or Full Circle Health for contracted providers and or prospective providers. The links are in the Kaiser Permanente slides that Melissa just shared, but I'm also happy to kind of drop the link to these office hours in the chat as well. And I think that might be it for me. Any questions?
Yeah, I'd love that link for the prospective providers, please.
Yeah, of course.
Thank you.
Any other questions for Camille? All right, well, thank you, Camille. That was great. I'm going to do one last shout out. Anybody from Health Plan of San Joaquin on to give an update? If not, we'll just keep moving. All right, shoot. I don't see anybody here, but we will keep going. Oh, Eliana, do you want to jump in here?
Yeah, thank you. I just wanted to call out that we did include our updated provider network, which starts on page 39, I believe, of this deck. That's going to be calling out our current provider network in both Stanislaus and San Joaquin counties for both ECM and CS. If you see your name listed under organization contact and that's not accurate, please let me know so we can update that information. Thank you so much.
Great, thank you. Good information, I love it. Thank you guys for all the information from the health plan side. All right, so to keep us moving, I wanted to do a quick poll for all of you guys to see if you have an interest in covering this topic in future CPI meetings or office hours. So one of the things that the state is launching in 2025 is a monitoring approach for ECM and community sports. They've put that out to the MCPs, and the MCPs will be doing their version of that monitoring with their providers. But we wanted to get a sense from all of you, would you like more information on this approach from like statewide level, not necessarily from the health plan level that we have in the two counties here today? So if you could just please jump in and fill out this poll, that would be really helpful. Well, no one's saying no yet, so that's good. Okay, it looks like it's slowing down. We'll give it 30 more seconds. All right, I think we can actually close it off. So it looks like you guys are interested in learning more. So the vast majority of you would like to get some more information on this. So we will start to incorporate this in some of our future CPI sessions. And of course, as the managed care plans roll out their plans for quality oversight and monitoring, we will have them present as well. All right, thank you guys. All right, now we're going to do a rapid fire discussion here. We would love to hear about some of the challenges you may be facing for ECM and community supports eligibility. The state is asking us for feedback on eligibility, and so we'd like to hear what you guys are experiencing out in the field so that we can share that back with the state. So we'd love to have somebody pop it in the chat, come off mute, let us know, are you having any challenges with eligibility? If you are, what they may be, and we will share this with the state, of course, without using names or organizations. Has anybody had a claim denied? Or not a claim, but a claim denied or referral denied? Carrie, I see coming off camera. Jump in here.
We have had some denied. I think right now our challenge is trying to figure out, so we're contracted for community support.
Okay.
We're considering becoming contracted for ECM through the PATH side. But then the question would be, I know we can't duplicate ECM and CHW, correct?
Correct.
And so trying to determine what makes the most sense in terms of like providing CHW versus ECM. I don't know if that's what you're asking exactly, but that's what we're trying to sort of figure out right now is like our capacity and then making sure we don't overlap on anything.
Right. So the ECM CHW is you can't build both programs for the same service to an individual.
Right.
And I've heard a lot of providers have really creative ways of doing this. Maybe they have the CHWs do some outreach to folks and then have ECM kick in. I don't know if I'm going to share what they're doing here, but I think there are ways to leverage both programs to really get folks into the services that they may benefit from.
Okay.
Yeah, can I chime in with that? So CHWs,
John.
you know, you can have them, you know, bill for CHW doing groups that, you know, educating, you know, clients and groups in regards to diabetes or eating healthier habits. And then you can have an ECM case manager that can provide like direct assistance with getting them to their doctors or providing them, you know, a care plan or a treatment plan that's totally different than the CHW. And so you don't, like I said, you don't want to overlap. But, you know, another thing you can look at too is like if you want to have CHWs, that's great, but you can just have ECM as your number one and just provide it that way. You know, the reimbursements, I believe, are a little bit more. Ileana could speak to that one, but I do believe the ECM rates are a little bit more than the CHW rates.
Yeah, thanks. That's helpful.
Thank you, Carrie. Thanks, John.
Yeah,
Anybody
Carrie,
else?
I'll just add that, you know, if there are questions around that, Carrie, we can definitely have a conversation, and we'll invite the SB here at HealthNet. But I think it's crucial to understand kind of like the CHW benefit, right? The CHW role as we see it in ECM. Because the CHW benefits, technically members may not need the intensity of services as an ECM member may, right? So I think it's differentiating that would be a good way, but we can definitely have a more like in length conversation of like what you're thinking of your structure, especially, you know, we have a meeting coming up, so we can definitely have that discussion around that too.
That would be a
we look
great
at
topic. Yeah.
CHW like a step down from ECM, right? Or they just may not need the full ECM services. So there's ways where you can kind of braid in the CHW services.
Great, thank you, Eliana. All right, anybody else have any challenges you've encountered with eligibility for ECM or community supports? Okay, if you think of any, put it in the chat. We'd love to hear that. We do want to share feedback with the state about what's working, what's not. So please, you know, let us know. All right, and with that, Melissa, I believe I'm going to turn it over to you.
Thank you. All right, so I'm going to close us out today. We're going to focus on talking about our collaborative goal. I'll give a little bit of background there. We also want to give you guys an insight into what to expect moving forward. We'll announce in person that we have coming up this month, next month, and then we'll close out with just upcoming priorities and events that we have coming through the pipeline. Next slide, please. All right, so just wanting to give everyone a quick snapshot of what to expect. So this collaborative does run through the end of this year. We host monthly sessions. I know there's a lot of new folks in the room, so just want to do a quick recap. We also host office hours. And through this endeavor, we are hoping to enhance staff understanding and consistency in determining eligibility for community supports and enhance career management. We are going to have a focus in case conferencing this year. We'll also work to collaborate with the MCPs and our regional SMEs to host dedicated learning sessions or office hours aimed at familiarizing staff with evolving standardized processes and tools, including some of the ECM referral standards and presumptive authorization that you heard about today. We'll bring on some revenue cycle managers to support with some of those billing and claims issues that some of you guys are continuing to have, and reinforce learning there. We're also hoping to continue our provider spotlights on different populations of focus and community support services. So I encourage you guys to use the chat if you would like to be part of a provider spotlight. We would love to have you and host you during one of our upcoming sessions. So please let us know if you're interested in that. And then we are also thinking of conducting a series of listening sessions to identify and gather insights on ongoing challenges around data exchange. So those will be peppered into some of our facilitated conversations over the next year. This is just a small snapshot of some of the work that we're trying to bring forward. There will be much more, and also really eager to know what you guys would like to cover over the next year. So please let us know in the chat as well. Next slide, please. Part of this work does include having us set a collaborative goal or aim statement. For those of you who have been with the collaborative, you know that each year we do set a collaborative goal to kind of lead our work. So last year we were focusing on this specific goal here, and we are planning to continue this moving forward. But we do want to understand what the percent change that seems the most feasible for each county would be. So for some background, we last year were assessing utilization rates of enhanced care management and community supports in San Joaquin and in Stanislaus County. We had set some goal percentages. This is mainly to kind of guide us in moving in a positive direction and increasing utilization in each county. But we're going to do a quick poll just to see what seems feasible for this group. So if you are a provider in San Joaquin County, what percent change seems the most feasible for this county? And if I can get that poll, thank you. And of course, this is for the entire year, right? So this isn't quarterly or anything like that. So 5% I'm seeing right now on my end is a change that seems the most feasible to increase utilization in San Joaquin County. And just to give you guys some background, we have seen San Joaquin County increase utilization kind of over the last year and a half through CalAIM implementation. They have been a lot more advanced than Stanislaus too. So kind of keep that into consideration as you're answering here. I'm going to give it maybe 30 more seconds to get some more input from the group. I'll do a 10-second countdown. 10, 9, 8, 5, 4, 3, 2, 1. Navneet, you can close that out. We'll go to Stanislaus County. So if you are a provider in Stanislaus County, would also love to hear what percent of change seems the most feasible in this county. And again, understanding that Stanislaus County does have less providers, they also are not as advanced as San Joaquin County currently is. I will say I'm seeing a bit of a tie on my end. Okay, I'll do 10 seconds here. And then Navneet, if you want to close it out after the 10 seconds. Okay, I think we're good. All right, so just to give you guys an idea of where we landed. So we did land at 5% for each county. We will put that in our collaborative aim statement and share this. We'll each quarter monitor this on a quarterly basis, kind of looking at the utilization for ECM and community supports and give you guys some feedback on what the county's progress is looking like. If we need to go back and make changes here, we'll do that. But we'll really be using this to define kind of what we speak to during the next kind of sessions over the next year. But thank you all so much for your input. We'll go to the next slide, please. Okay, I hope you guys are all excited. So this year we are hoping to host 4 in-person sessions. This February in-person session will be our first in-person session of the year, and then thereafter they will happen quarterly. This is a provider-facing in-person session, so I know we've done some resource fairs in the past. This is not a resource fair, so just want to underscore that. This session will aim to support local providers in building relationships, sharing best practices, discussing opportunities for improving provider referral coordination, and more. We will share a final agenda by February 3rd for those of you who are interested in learning more about what's on the agenda. But this is a kind of nearly 4-hour session scheduled for February 25th. We are going to host this in Modesto. So we do ping pong between the two counties. Our first county will be Stanislaus and the next one will be in San Joaquin. We do encourage all local health and social service organizations, including hospitals, community-based organizations, tribal programs, direct service providers, FQHCs, etc., to join us. And those of you who are providing services in Stanislaus, we also strongly encourage you to attend. Before I move forward, we are interested in hearing about what you would like to talk through during the in-person meeting. We do typically drive our agendas based on the feedback that we receive from you, and are really interested in seeing if there's any special requests that we could bring, even if it's having John bring us some donuts or something. Yeah, Anthony, we will send out confirmation emails. So this is being collected through SurveyMonkey. You won't get a direct email that your registration is confirmed, but we will go back through and send information to everyone who's registered.
For those that attended our in-persons in the past, were there any activities that we did that folks want to make sure we uplift again? I know over the summer we did an MCP Q&A panel, and that is something we're planning to incorporate for this session. So if there are any of those ideas as well, welcome that as well.
Yeah, and Jasmine, I see your comment in the chat. Did you want to come off mute and speak to that a little bit more?
Hi, yeah, this is Jasmine. Just any kind of gaps in services that we're experiencing in this county. And this was like with that path cited funding in mind as some of the priority areas that are being addressed, and how San Joaquin and Stanislaus can fill those gaps. If that makes sense.
Yeah, thank you. Anybody else? Can I get a raise of hands for any of you that have already registered with the link that Navneet shared or are working on it? Oh, 1, 2. Okay, awesome. 3. All right, so that survey does include a line for you guys to provide us with any feedback. So we'll continue to review those and collect some of that feedback from you guys, but I'm going to move forward to the next slide. Okay, so we were really busy last quarter, and as a result of all the information that we've shared during this collaborative, we did pull together a couple of resources. These do currently live in our external shared folder, but we are hoping to set up a site where you'll be able to access these. So during the last year, we collected promising practices. We did create a promising practices report. It does highlight practices that have been implemented in San Joaquin and Stanislaus counties, as well as our Northeast Collaborative. These are practices that can be implemented in rural areas, learnings from other organizations that we acquired, and so those have been put into this report. The links will be shared in the chat. We also pulled together referral journey maps. So for those of you who are curious about the process for Health Plan of San Joaquin, HealthNet, and Kaiser, we do have those referral process maps. They were reviewed by all 3 health plans, and they provided feedback to us to ensure that the information is accurate. But just to note, there may be updates every couple of months. We have a streamlining payments job aid. So for those of you who would like to understand how to streamline your payments and use a quick tip sheet, that is available. That will also be shared. And finally, we have 2 infographics. So we have one for birth equity and one for justice involved. These are intended to be shared with the community. They are community facing, but you can also share them amongst yourselves. They highlight some of the eligibility criteria to receive those birth equity and justice involved services, and who to contact or how to contact your health plan. If you would like to put your logo on these, please feel free to do that. You can also include any additional information for your organization. If you need us to create space for you, we can also do that so that you can input your contact information. Currently, these are not tied to any specific organization. Next slide. Okay, and to close us out, we do have some office hours and 30-minute one-on-ones available. Our next office hours are going to happen on Thursday, January 30th, 10 to 10:45. These are open drop-in office hours for peer-to-peer support. If you have any additional questions that were not answered today, or as you are joining some of these cited or JI-focused webinars and would like to learn more, please join us during those office hours. We also host 30-minute one-on-ones as requested with organizations. We typically provide an overview of Medi-Cal transformation, an overview of our collaborative for those of you who are new, strategies to engage with your MCP and your peer providers within the region. So for those of you can contact Navneet, and we also have the link to the office hours that's available. I think that's it. I'm going to hand it over to Navneet to close us out.
Thanks, Melissa. That was all that we had for you all today. Hope you all have a great rest of your day. And if any questions come up, my email is always open. Bye, everyone.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.